Today we're going to talk about the Renin, Angiotensin, and Aldosterone system blockers and the risks of Covid-19. First, we need to define a few terms. First, we need to talk about the Renin, Angiotensin, and Aldosterone system. The Renin and Angiotensin system, or RAS, or also called Renin, Angiotensin, Aldosterone system, RAAS, is a hormone system that regulates blood pressure and fluid and electrolyte balance, as well as the systemic vascular system. Now we're gonna watch a video explaining it a little bit better.
Renin Angiotensin Aldosterone system. The renin angiotensin aldosterone system is a classic endocrine system that helps to regulate long-term blood pressure and extracellular volume in the body. The system begins with the release of angiotensinogen into circulation by the liver. This may be in response to low blood pressure and adverse changes in sodium concentrations. An enzyme, renin, is secreted which cleaves angiotensinogen to form the inactive decapeptide angiotensin 1. Further transformation of angiotensin is carried out by angiotensin-converting enzyme, or ACE. This is predominantly found in the pulmonary circulation. However, ACE is also produced in the vascular endothelium of many tissues, including the kidney, adrenal gland, brain, and heart. The angiotensin-converting enzyme converts the inactive precursor angiotensin 1 into the vasoactive peptide angiotensin 2. In addition, alternative pathways exist that do not rely on either renin or ACE. In non-renin pathways, enzymes like tonin and cathepsin D release angiotensin 1 from angiotensinogen and tissue plasminogen activator, or TPA, and can make angiotensin 2 directly from angiotensinogen. This bypasses the midway production of angiotensin 1. Enzymes like chymase can form angiotensin 2 from angiotensin 1 via an ACE-independent pathway. Angiotensin-converting enzyme also degrades bradykinin, which is required for synthesis of a major vasodilator, nitric oxide. Angiotensin 2 binds AT1 receptors expressed on the surface of vascular endothelium and impairs nitric oxide synthesis as well. Reduced bioavailability of nitric oxide, combined with the stimulation of AT1 receptors on smooth muscle cells, causes vasoconstriction. In addition to a vasoconstriction effect, stimulation of AT1 receptor causes the adrenal glands to release the hormone aldosterone, resulting in sodium retention. Combined with vasoconstriction, this increases blood pressure. In the final stages of RAS, the kidney reduces the production of renin. Most of the known actions of angiotensin 2 are mediated through the AT1 receptors, which can be found in the kidney, heart, vascular smooth muscle cells, brain, adrenal glands, platelets, adipocytes, and the placenta. Angiotensin 2 type 2 receptors can be found in low levels mainly in the uterus, adrenal, central nervous system, heart, and kidney. AT2 receptors appear to counteract the effects of AT1 receptor stimulation. Another angiotensin 2 type receptor is the AT4 receptor. Its stimulation may increase synthesis of the natural inhibitor of TPA called PI1, thereby reducing effective fibrinolysis. Stimulation of AT4 receptor appears also to promote cell growth and proliferation.
Now, to define what are the renin, angiotensin, and aldosterone system blockers, or also called inhibitors. Renin, angiotensin, aldosterone system inhibitors are a group of drugs that act by inhibiting the renin, angiotensin, aldosterone system and include the angiotensin converting enzyme ACE, previously mentioned in the video. These are also inhibited as well as the angiotensin receptor blockers, the RABs. and direct renin inhibitors. Here we gonna watch a video about how the ACE inhibitors works.
If your doctor has prescribed you ACE inhibitors such as ramipril and enalapril, it may be because you have high blood pressure or heart failure or have had a heart attack. ACE inhibitors work by inhibiting the mechanism that the body normally uses to maintain blood pressure. Angiotensin 1 is an enzyme in your bloodstream. Angiotensin converting enzyme, ACE, converts angiotensin 1 into angiotensin 2. Angiotensin 2 is an enzyme that narrows your blood vessels and releases hormones that can raise your blood pressure. ACE inhibitors stop ACE from doing this conversion, reducing the levels of angiotensin 2 in your body. Lowering your levels of angiotensin 2 relaxes your blood vessels and reduces your blood pressure to a normal level. Lowering your levels of angiotensin 2 also means more salt passes through your kidneys and takes water with it into your urine. Reducing the amount of fluid in your body means there is a smaller volume of blood for the heart to pump. By relaxing your blood vessels and reducing the amount of fluid in your blood vessels, ACE inhibitors help to control your blood pressure. This reduces the strain on your heart and arteries. If you have heart failure or have had a heart attack, ACE inhibitors may also be used to help improve your heart's muscle pumping action. So, you may be prescribed ACE inhibitors even if your blood pressure is at a normal level. Before you stop or change any medication, even if you're worried about side effects, talk to your GP first, as changing or missing a dose could harm your health.
The third term we need to define is the Covid-19. The coronavirus disease 2019, also known as Covid-19, is an infectious disease caused by a severe acute respiratory syndrome coronavirus 2, or also called SARS-CoV-2. It was first identified in December 2019 in Wuhan, China, and has since spread globally, resulting in an ongoing pandemic. Common symptoms include fever, cough, fatigue, shortness of breath, and the loss of smell and taste.
COVID-19 is a type of coronavirus that causes an infection that is now spread all over the world. There are a lot of kinds of coronaviruses. Most cause the common cold, but other coronaviruses are more serious. COVID-19 is new and hasn't been seen in people before. And for some people, it can become serious and dangerous. COVID-19 spreads person to person through droplets from coughing and sneezing. It can also spread when you are close to someone who is infected. It may be spread when you touch something that has the virus on it, such as a doorknob or countertop. Most people have only mild symptoms or even none at all. Symptoms can include a cough, a fever, and shortness of breath. When COVID-19 is severe, it can make it hard to breathe without help. People who are very sick are treated in a hospital. If you're having symptoms, call your doctor, because they may want to do a test. If you get a test, a swab will be used to take a sample of fluid from your nose or throat. Even if you don't feel sick right now, it's important to protect yourself and others from getting sick and spreading the infection. Here's what you can do. Limit where you go in your community, and stay home to avoid people who may be infected. It's also important to wash your hands often and well, especially after you cough or sneeze. Use soap and water and scrub for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer. Avoid touching your mouth, nose, and eyes. Stay home when you're sick, and ask people not to visit you. As healthcare and other community services learn more about COVID-19, information can change. It's a good idea to know what's happening in your community, schools, and work. Find reliable sources of information that give you facts about new cases and what you can do to prevent spreading the virus. The Centers for Disease Control and Prevention and the World Health Organization are two online resources that you can trust. Thinking about COVID-19 and what it might mean to your family and to your community can be scary, but it can help to know that although the virus can be serious, most people recover. Knowing how it's spread and how to protect yourself can help everyone stay healthy.
Now, we need to talk about the applications in medicine. This is the extraction of a result in an article published in May 1st, 2020 that states that in a large population-based study, the use of ACE inhibitors and RMBs are more frequent among patients with COVID-19 than among control because of the higher prevalence of cardiovascular diseases. However, there was no evidence that ACE inhibitors or RABs affect the risk of COVID-19. Here is an extraction of a Q&A made by a representative of the National Kidney Foundation in US.
So what about ACE inhibitors and angiotensin receptor blockers? I have hypertension. I take an ACE inhibitor. I'm going to keep taking it. I think you should too. I think this is a terrible time to be adjusting your medications if you're doing well and your blood pressure is well controlled. These medications prevent kidney disease progression. They reduce your risk of heart disease. So very important to continue taking those. If you God forbid, become infected, and I don't wish that on you, but if that happens, that's something that the care team may decide to address. A decision to stop a drug now is really up to your clinician and no one else. And certainly you as a patient should not stop your medicine because of some fear that probably we don't understand yet and needs to be studied more.
Now we're going to talk about the pros and cons of this statement made by the article published. Now in this study, we can be more careful with patients that are treated with this type of medications, therefore having a better control with the evolution of these patients if they do contract the coronavirus. Talking about the cons, we can state that the results of the research will generate fear and uncertainty on people that are using this type of medication, causing them to stay in a worried state. This problem due to the fact that most of the people treated with the medications have heart or blood pressure related problems would be very serious due to they can feel nervous, increasing their blood pressure. Now we're going to refer to this issue applied in Ecuador. In Ecuador, 9.3% suffers from high blood pressure and 10% of the population suffers from renal insufficiency. 34,151 cases of COVID-19 are present in this country. Taking these numbers into account, we need to know that there is a very high risk of patients in Ecuador due to the usage of the type of medications. Therefore, knowing that there is a higher risk of contracting this COVID-19, possibly by patients that use this type of medications, we need to have that into account and take control of it. Now we're going to see a small report made about Ecuador and COVID-19.
This family is stuck outside of their house because their dead relative's inside and has been for some time.
We have been waiting for 5 days. We're tired of calling 911, and the only thing they say is to wait a bit more.
It's something that's happening across Guayaquil in Ecuador. Many bodies have simply been left in the street. The collapse of funeral services, full cemeteries and a curfew has meant that many aren't able to bury their dead, and authorities are struggling to help.
Every day we're getting hundreds of calls from people in Guayaquil who have their dead loved ones in their houses, their cars, their neighborhoods. Others were turned back and told to take this. Others didn't even get ventilators or oxygen tanks.
The country's been among the worst hit by the coronavirus in Latin America, and Guayaquil, its largest city, is at the epicenter. It's around 30 degrees here. It doesn't quite fit the theory that heat can stop it. On Tuesday, the mayor, herself in isolation with the virus, announced more emergency measures.
Today, the first of the 4 large refrigerated containers arrived to deposit the bodies of the people who lost their lives inside the hospitals or who also lost their lives in their homes.
She also promised extra beds for medical staff and emergency food kits. But many are far from happy with the national government. This was the health minister till a week and a half ago. She resigned, saying it lacked the resources to deal with the pandemic.
The relatives around here suffering, living in poverty. Supposedly the government says that here they will help them, but they give nothing. Everything they say is a lie. Everything is just blah, 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 blah.
Meanwhile, people wait outside of Guayaquil's overwhelmed hospitals, not knowing if their loved ones will come out alive or be added to the long list of the dead. John Holman, Al Jazeera.
Now, we need to state the conclusions in 3 statements. First, due to the high population with high blood pressure and renal insufficiency, people should be aware of the risk that they may be on. COVID-19 may result in various complications and sometimes death. The virus that causes COVID-19 is highly contagious. Therefore, everyone should take the recommended cautions, not only people with high pressure and renal deficiency.